Ms. Schakowsky for 5 minutes.
Thank you, Chairman Murphy and Ranking Member DeGette, for calling this very important hearing on prescription drug and heroin abuse in the United States. Also, thanks to our witnesses for coming here today to shed more light on this issue. This hearing could not be timelier. Increasingly, we're hearing reports of the toll this crisis is taking in communities across the country. And like myself, I'm sure that every member of the subcommittee has heard stories from their constituents about the toll of prescription drug abuse and heroin abuse, the toll that it's taken in their districts. I have mentioned previously before at this committee that I have a constituent, Peter Jackson, who tragically lost his 18-year-old daughter, Emily, after she consumed a single OxyContin tablet that she received from her cousin while visiting family. I look forward to hearing from our witnesses about the most effective ways to combat prescription drug abuse, to learn what additional steps we can take together to stop this crisis and to prevent the further tragic loss of life. I also want to call attention to the impact that reducing discretionary spending will have on access to treatment and research on addiction. Just yesterday, House Republicans approved budget allocations that will further cut discretionary spending for vital programs like SAMHSA and the National Institutes of Health. We've already seen devastating cuts to these same programs. For example, the Substance Abuse Prevention and Treatment block grant within SAMHSA, when adjusted for inflation, has actually been cut by 25% in the last 10 years. While we're here today to discuss the most effective methods of treating addiction, without federal funding for programs, patients will simply not have access to these services, and research on addiction and treatment of addiction will greatly suffer. That's just a fact. If we're serious about combating the opioid epidemic, it is incumbent that we provide strong federal funding for the programs that patients and researchers rely on. And I want to yield the balance of my time